You are watching the DocTalk show.
Welcome back. You're watching the DocTalk show, and we're discussing one of the cancers that's most common in women. Unfortunately, causes a lot of deaths in women. This is cervical cancer. Much as it's a very prevalent or very common cancer in women, it is highly preventable if we institute measures to detect it early enough and treat it. With me in the studios are experts in the field, Dr. Musingizi and Dr. Mugisha, to help us understand what treatment options are available to treat this condition called cervical cancer, and if there are ways we can prevent it in the long run, prevent people from getting prevent women from getting cervical cancer. Okay, are there any other apart from the kidney, anything else you should worry about in cervical cancer?
Yeah, like any other advanced cancer, whether cancer of the lungs, cancer of the pancreas, gut, once it starts moving in blood, you could talk about complications of any magnitude, whatever length. If we had to start with just the local invasion of structures within the reproductive areas, it will even stop blood flow from the lower limbs, the legs. So blood and some fluids that ideally would drain cannot go up or to the heart to be pumped, and also you see your legs swelling over time, which we call edema, swelling. Sometimes you can't move. They affect the nerves. You get numb. If it goes into the brain and the spinal cord, you will have all those sequelae. You will have strokes,
like
as you had.
paralysis and strokes.
Yeah, might have strokes, numbness of various degrees, depending on where that is really affected.
Okay, so all these problems we're talking about, they mainly occur in the late stage, in the advanced stage. So it means if someone is able to pick this cancer and treat it early enough, they can avoid this.
Actually,
problems.
I think altogether in the screening process, you can prevent it from becoming cancer. Okay? So like if you get it early enough and you treat the virus, the local invasion of the HPV at the cervix, you can prevent it from becoming cancer. That's why we think that it is a more lenient version of cancer. If we can get it early, you don't have to progress
Before
to
it actually becomes an established cancer.
you don't have to get to cancer.
So how exactly can we screen and prevent this cancer? By catching it before it progresses any further.
In our Ugandan system, we have about four prevention methods we can use or that are at our disposal as health professionals. The first, and which we think is at the lowest levels of healthcare in Health Center 3, Health Center 4, is just visual inspection. And if we see any abnormalities, we know what it should look like, any color changes that we do not expect as suspicious at the very least, and therefore necessitate us to go to the further screening techniques.
So that first test you said is called visual
inspection. Yes.
Inspection.
Visually look at the cervix.
Okay.
That is all.
Okay. And it's available at all the health centers.
Yeah.
It should be available.
Okay. So if are there any other ways we can detect this cervical cancer before it goes out of hand?
The one that has really been the cornerstone of prevention of cancer cervix worldwide, and also that the government is trying to intervene in and make quite available, is what we call the pap smear.
The pap smear.
Pap smear.
What is the pap? Help people understand what this pap smear is.
Pap smear.
Yes.
Basically, in simple terms, we just need a few cells. We brush off a few cells of the cervix, off the mouth of that uterus, just a few cells, and look at them under a microscope. So with that aid, we can actually tell that these cells are beginning to become stubborn. They are not yet cancerous. Yes, if they are, we can still see. But as long as we see a little difference, a little deviation from the normal appearance of these cells, we then act accordingly. So pap smear, by and large, is what is most credited for the turnaround worldwide of prevention of
cervical cancer.
Yes.
Dr. Daisy, is this pap smear test available in the hospitals? Which hospitals have this test?
Pap smears are done, I think, in all regional referrals. Should be able to do these pap smears.
Okay.
It's basically just an office procedure. The patient comes in, you do a swab or using a brush, the specific
A specific type of brush.
yes,
And
apparatus.
it's done under the supervision of a gynecologist.
It must be done by
Must
a
be done under a
gynecologist.
gynecologist.
Yes.
Okay.
Because you're collecting cells from the upper part of the vagina and the cervix.
Okay.
Okay, so you need to know what goes where.
Okay. So if you say the key message is to prevent cervical cancer, some tests can be done, which include the pap smear, but should be done under the supervision of a gynecologist.
Yes.
To make sure it's done right, so that you can actually diagnose the
Yes.
problem.
You see, the problem with that, however, is there are not so many specialists, gynecologists, as you want to put in. So then you restrict the diversity or the availability of some of these services, especially in very low resource settings. So being stringent on a gyne might not really hold so much water, and we think really a health personnel, well trained, can be able to just make a brush or scraping of those cells and send to the lab for cytology.
Okay. So remember, you're watching the DocTalk show. We are discussing cervical cancer and how we can detect it early. Our experts in the studio have told us some tests can be done at the hospitals. One includes a visual inspection of the cervix to see if there are any abnormal changes in the lining of the cervix when we use a liquid called acetic acid. The second is probably a more sensitive test called the pap smear, where a special brush is inserted into the cervix. It scrapes off some cells and it's studied under a microscope. And there the doctor can tell if indeed the cells are normal or they becoming abnormal towards the stage of cancer. So Dr. Daisy, how is this condition treated, this cervical cancer?
Before we talk about treatment, we were earlier discussing screening, okay? And I think we hadn't fully exhausted I think about 2 other screening methods that are used today.
Okay.
One is HPV testing. Okay, we test women above 30 for HPV and
For the virus?
Yes, for the virus itself. It's more sensitive, but it's also quite costly. But those are some of the current screening methods. Another one is using colposcopy. Colposcopy is basically getting a camera that magnifies the cervix. Okay, you focus it on the cervix and it magnifies, and you can easily identify if there are any anomalies on the cervix.
On the cervix. So that is in addition to the pap smear and the VIA, the visual inspection.
Yes, visual inspection is more like, it's not as sensitive.
Okay, it's not accurate.
Yes. So normally when these VIAs are done in the health centers, for example, and these women are identified as having some sort of abnormality, they are sent to, for example, Mulago for further testing, where you'll do the pap smear or you'll do the colposcopy. And
so VIA is like the starting point, then we can use the pap smear.
It's the least sensitive.
Then the other more sensitive tests. But are they available in the country, these tests you talk about?
Yes, they should be available in the big hospitals.
Okay. So at the very least, you recommend at least every woman should have a pap smear?
At least a pap smear if you're above 21.
And how often should they do this?
It should be done every 3 years. However, if you do a pap smear as well as HPV, then you can take 5-year intervals if they are both negative.
Okay. So periodic monitoring of these tests with the pap smear or with the additional more sensitive tests, at least 3 to 5 years is recommended for every woman of reproductive age in order to detect cervical cancer so that we can treat it early enough.
You are watching the DocTalk show.